I want to just say a few things about COVID. Every week I talk about COVID-19. You know, if you join our Facebook page, our Instagram, we're on Twitter, we're on LinkedIn, we're on YouTube. If you go up there to Healing Our Village Official, I have tons of videos up there that you all need to watch as it relates to COVID. There's so much misinformation. Today I was listening to my news programs this morning. And so they said some numbers I thought I needed to share with you today. So 55% of African Americans live in the southern states. 55% of African Americans live in the southern states. So that's Mississippi, Alabama, Georgia, Louisiana, Tennessee. Those are all this southern states. We also call it the stroke belt because the people who live in that area have hypertension, they have diabetes, they have obesity, they have all the things that make you more susceptible to getting COVID and having the worst sequelae of COVID, because diabetes, hypertension, obesity, COPD, asthma, lupus, all of these things that we find in African Americans increase your susceptibility to getting the virus, especially this more contagious Delta virus. Okay. So right now in hospitals throughout the country, but most certainly in the South, North Dakota, South Dakota, Idaho, Iowa, okay, there's all these folks that don't want to take the vaccine. I had a long conversation with one of my colleagues and friends, this young lady that I know. Brilliant, she's brilliant. She's a producer. And so I'm having a long conversation with her. She got COVID, she got sick, she recovered. You know where she got it from? She got it from her 9-year-old, who got it from his grandmother, because his grandmother decided to not get vaccinated. So she gets COVID, gives it to the 9-year-old, who then brings it to my friend. All right? So she was sick. She couldn't even walk. Took her a couple weeks to get better. And she's still not 100%. What people don't get is if you get COVID, it takes a long time. And some people never get back to where they were pre-COVID. They're called long haulers. They have COVID and the symptoms of COVID that affect them for long periods of time. So I hear people say all the time to me, well, you know, I didn't get sick last year, so I'm just going to take my chances. I don't want to put this vaccine in my body. Okay, which I don't get that, because we put everything else in our bodies. And you guys don't question that, but you're questioning this vaccine. So right now in the hospitals, right now today, the people who are in the hospitals in these southern states and in these other pockets are people who aren't vaccinated. And they're dying. I did an excellent episode last week. You got to see this episode. I have 2 hospital pharmacists, the Doctors Peters. They own a pharmacy up there in the Maryland area, and we talked about what it looks like to be in a hospital with COVID, on a respirator and on a ventilator. You got to watch this episode. Just please share it with everybody you know. So the statistic I heard today is that 55% of African Americans live in the southern states. And as of today, 120,000 children have lost either one parent or 2 parents. So now kids are in school. These kids, some of them are carriers. They're bringing that COVID home. And you're hugging your kids and kissing your kids and reading to your kids and being close to your children, and you're not wearing a mask at home. You're not wearing a mask at home. And so if you're unvaccinated, you're putting yourself at risk. So when your kids give you this COVID, you're getting sick, going to the hospital and dying, leaving them orphaned. Who's taking care of them when you're not here? I don't get that. Why would you do that to your children? Why would you do that? You need to know the COVID status of your kids. If your schools are not testing your kids in the school and vaccinating your kids at school, if you're not taking your kids out to get vaccinated, If you're not testing yourself weekly, so you don't know what's going on, you're just in this world of denial, shame on you. Shame on you that you would leave your kids orphaned in this world that we're living in today. So we got to do better, folks. You got to do better. Instead of fighting the school system regarding masking and social distancing and testing, instead of fighting the school system, instead of not supporting their choices, what you need to be figuring out is all that CARES money that came down in January, February of this year, that came to your state, that came to your county, that came to your city, you need to be asking, how much money did the school system get to change out the ventilation systems? Did that happen over the summer? Did we have new ventilation systems in our school? What has the school done to make sure that the environment in the classroom is safer than it was 6 months ago? You need to know that. You need to ask those questions. Because the schools, many of them got money and it hasn't been spent yet to do those things. So that's very important. So, COVID-19, we have a website. Please go up there. Please listen and see and download everything that we're doing. Please, I'm asking you.